right, welcome back to the conversation. There's been a lot of talk about what is the right model in terms of treating coronavirus. Should we do more testing, less testing? Some of the answers are clear, but there's a lot we could learn from what other nations have done. Well, that's what Andrew Romano set out to study. He's a Yahoo News national correspondent, and he wrote about the German model versus the Swedish model, and he joins us now. Andrew, great to have you on the Young Turks.
Hey, thanks for having me.
No problem. So, Andrew, first let's talk about the Swedish model, because a lot of right-wingers, including Rand Paul, are quoting it and saying it's great, it's amazing, that's the right way we should go. So what did Sweden do?
Yeah, so Sweden never instituted a hard lockdown. They basically advised the public there to practice, common sense social distancing measures. They limited gatherings to 50 people or less, but they let businesses stay open, bars, restaurants to some degree, schools to some degree. And the whole point was to sort of put agency with the population as opposed to putting in place, harsh lockdown measures. And to kind of let it, to a certain degree, the pandemic kind of run its course through the population. There's been some positive aspects of this and some negative aspects, which we can discuss.
I do want to get to that in a second. First, let's lay out the German model as well. So what do the Germans do instead?
The Germans did a hard lockdown. They relied heavily on data, especially R0, which is the measure of the transmissibility of the virus at any given point. If R0 is at 1.0, it means that each infected person is passing it to one other other person, and the epidemic is kind of staying at a level, a scale. If it goes over 1, that means each person is passing it to more than one person. If it goes below 1, then fewer. So shrinking if it's below 1, growing if it's above 1. And it kind of measured that, watched it closely, and used it to determine policy. So they did a hard lockdown. Once they saw that case numbers and deaths were declining, once they saw that R0 number coming down, they decided to reopen. With a data-driven snapback measure in place. If cases sort of progress past a certain point in a given municipality, then lockdown would resume. So they're in the process of sort of dealing with that now. They've seen it go up in some places. They've put lockdown back in place in those areas. But in general, they've done pretty well as they've tried to emerge from lockdown.
How important is testing to the German model?
It's very important. I mean, they instituted widespread testing early on. They tested people who weren't necessarily showing symptoms to get a sense of the scale of the pandemic in the country. They've been pretty methodical and organized about it, as you would, expect Germans to be.
How about reopening? You mentioned that they had reopened in a lot of places. Are they more reopened than we are at this point?
Well, I mean, measuring how reopened the United States is a difficult thing because we're such a patchwork system. There are certain places like here in LA, which are doing a couple of things here and there to reopen, but really, we're pretty much still in lockdown. Places like Georgia, on the other hand, are, pretty much open. Businesses have resumed. You can go bowling, you can get your nails done, you can get your hair cut, which I'm sure a lot of us need at this point. In terms of Germany, I would say overall they're probably more reopened than us. They're a little further along this path, although we're catching up quickly in the United States.
Trump often brags about how much testing we do, and then if you ask him any questions about it, he gets really touchy and calls you nasty. But how are we doing in testing compared to, let's say, the Germans, who have been considered to be doing a really good job at it?
Yeah, we've ramped up. I mean, there was a point where our testing per capita was really, really low. We have been really ramping up a lot. So I think we're sort of getting to a place where we might be, at least in some places, and again, it's such a patchwork here, and some states are doing better than others, where we are on sort of par with Germany. I don't have the per capita numbers in front of me, but we've increased so much, I think, at this point that there are places where not enough people are taking advantage of the testing capacity. I think the broader question about reopening in terms of testing and contact tracing here is whether we have the sort of infrastructure in place to kind of jump in quickly, do a ton of tests, have the contact tracers in place to shut down flare-ups when they inevitably pop up in places that have reopened. That's what Germany has done really well. So it may be less a matter of the raw number of tests and more a matter of organization, how well that infrastructure is set up to respond quickly when we've seen flare-ups. So last week, they started to see the numbers creep up, I think, in 3 areas of the country, and they quickly put in place, resumed lockdown measures in those areas. I don't know that in the United States we have the sort of infrastructure in place to do that. I also don't know if we have the kind of political psychology to do that. I feel like when people are reemerging from lockdown here, especially with that American mentality of, sort of independence and individuality, that they're really going to want their state, local or federal officials to kind of come back in and put in more government control. In Germany, they've been a lot more sort of accepting of that.
But I want to go back to comparing the Swedish and the Germans, because the Swedes said, hey, let's just, maybe herd immunity. If enough people get it, we'll develop immunity. How did that turn out? When you compare the numbers of Sweden versus Germany, who wound up handling the crisis better so far?
Yeah, it's a really good question, and it's hard to say. So what we've seen in Sweden is disproportionately high fatality rate. So there are more people dying there per capita than in similar neighboring countries like Denmark and Norway that locked down. In fact, over the last 7 days, there was a new Reuters report about this that just came out. I believe that Sweden had the most per capita deaths from coronavirus of any country in Europe. And that's including countries that have been much harder hit, like Italy and France. So you're seeing, frankly, sort of more death per capita there. If the sort of fatality rate in Sweden was replicated here in the United States, we would have seen probably about 35,000 more deaths, so well over 100,000, just to give people a sense of that. That has been the downside of the Swedish approach. The upside is that people haven't sort of retreated into their homes as much. There hasn't been as much isolation. They felt a little more connected, so economically there's some sort of mixed signs. We'll see what happens, but that at least in the first quarter of the year, their economy has not taken as much of a hit as neighboring countries. So there's sort of upside and downside to it. It's kind of a question of how much government control are you willing to accept in exchange for how much of a fatality rate. And Sweden is leaning more to sort of letting the virus kind of run its course a little bit through the population.
Yeah, so I get it. I'm not surprised that their economy would be doing a little bit better because they didn't have to lock it down. So that's logical. On the other hand, the highest death per capita of that neighborhood is not a good sign. And so then it gets to the question of who's dying. So in terms of people getting sick, anybody can get sick. So, but in terms of the people who are more likely to die, well, it's been the elderly. And so if that equation holds, it seems to me, looking at it from the outside, that what the Swedes decided to do was, in effect, whether they intended to or not, is sacrifice the old to preserve their economy and their freedom of movement. And that seems to have been the result.
Yeah, it's a harsh equation, but there is some truth to that. I mean, obviously, if you're not putting in place stricter social distancing measures, the virus is going to spread, and it's going to affect more vulnerable populations because of that. So, as you said, the elderly in Sweden sort of disproportionately affected. I believe something of half of the deaths have occurred in elder care homes. They've admitted that that's been a huge problem there. In immigrant communities as well, it's been a problem, and so it's affected more vulnerable people, and that does seem to be, to some degree, the trade-off they're making. I think the question is, they've been kind of circumspect about whether they're actually trying to achieve herd immunity, but the epidemiologist who's kind of in charge of their program there has claimed that something like 25% of people in the country have contracted the virus, whether it's symptomatic or asymptomatic, that there's a large number of people who've had this already and that they're closer to achieving that herd immunity. Now, that data is very suspect. It would suggest, a sort of a prevalence rate that was equivalent to New York City's and the New York metropolitan area, where there's been far more deaths than you've seen in Sweden. And so it doesn't seem like they have their data right on that. And if they don't, it means they're not nearly as close to achieving herd immunity as they think, and that the virus is going to continue progressing through the population and continue affecting these vulnerable, members of the community.
Yeah, so I get the trade-offs. I don't know about other folks. I love my parents too much to make that trade-off. So no deal for me. But last thing here, as we're out of time, Andrew, is there really a case to be made against the German model? If you can do that amount of testing and tracing, is there really a downside to doing it that way? Because it seems like they reopen the economy quicker and they have less deaths. So where's the downside?
Yeah, I think the answer to that question is the if that you proposed there. If you can do it, if you can do that tracing, if you can do that testing, and if you're willing to accept as a society that level of government intervention. And America is a very different country than Germany, and we haven't put in place the infrastructure as rigorously, and we don't seem to be as politically open to the kind of snapback measures that Germany has put in place. So I'm skeptical that we can do that here in the United States. It seems like we're moving almost more towards a Swedish kind of model, at least in some states, and we'll see how that plays out.
Yeah, unfortunately, I have a sense of how that's going to play out. And that might be why Florida and Georgia currently are hiding their real numbers on coronavirus cases. All right, Andrew Romano from Yahoo News. Everybody check it out. Really great article comparing the two systems. Thank you for joining us.
Thank you so much.
On the go? Don't worry, we got you covered. You can still listen to TYT at our new podcast network. Find us on Apple Podcasts, the Google Play Store, or at tyt.com/podcast.